Hi, I'm Brittany Mosley, nurse practitioner with White-Wilson DeFuniak Springs. Today we're going to talk about hurricane preparedness and healthcare consideration. Hurricane season starts from June 1st and ends November 1st. However, we know that there's other natural disasters that can occur, such as floods, chemical disasters, tornadoes, and any other natural disaster you can think of. When a natural disaster strikes, here are some things to consider. It is very important to make sure you have your emergency preparedness plan complete before the disaster strikes, as sometimes it can be difficult to know exactly what to do when you're in basically a panic mode. Oftentimes we do have the necessary food and water in our emergency preparedness kits, but a lot of times we forget about those with special dietary needs, such as diabetics or those with celiac disease. It is also important to make sure that you have enough formula for your infant for at least 72 hours. A first aid kit is handy, however, do not forget your important medical devices such as CPAP machines, nebulizers, inhalers, assistive devices such as wheelchairs, walkers, or canes. Also, it is important to not forget your EpiPen or your glucose monitoring machine. Also necessary during an emergency is making sure you have at least 2 weeks worth of your medication. Florida law states that if you are in a natural disaster state, you can have a 30-day emergency fill done. Also, make sure that if you have medication that requires refrigeration, that you bring something to help keep that medication cool. Finally, it's important to have important documentation with you in the event of an emergency. Part of this will include a medication list with your most current medicines that you're taking, along with how you take it, how much you're taking, and how often you're taking it. Another thing to consider is having records of your vaccines along with your allergy list. Some other documents that we often forget behind are going to include your birth certificate, death certificates, social security card, passports, and even living will would be important to carry with you. In the time of an emergency, it can be easy to forget about your health and wellness. I am Brittany Mosley, nurse practitioner with White-Wilson in DeFuniak Springs.